Greetings and welcome to the Lurie Children's Community Provider Symposium. This symposium is created for you, our pediatric healthcare provider, our practice managers, and of course, our referral coordinators that we love working with so much. My name is Chad Worley. I am your physician liaison for the north side of the city, the north and northwest suburbs, and I'm here joined by my colleague, Julie Kalkbrenner, who you all know very well, who is the physician liaison for the western suburbs. We have a great lineup here for you today. Along with Julie and myself, we'll be introducing you to Aric Shimek, who's we'll be talking about our new immediate care telehealth program. Then we'll send it over to Dr. Robert Greenberg and Brianna Brady, who will be talking to you about our new complex care program that I know so many of you are looking forward to hearing. And then, of course, we can't wait to bring in Dr. Suresh, our Chief of Provider Integration, for you all to meet and ask questions. Speaking of asking questions, we would love for you to go ahead and ask questions in the chat room that you see in your control panel on the upper right-hand corner. And if you feel so obliged, you can also raise your hand and ask a question live after each presentation. And then following Dr. Suresh's presentation, we will have an open forum and live chat with you all and to see if there's any additional questions you want to hear about Lurie Children's, any programs, physicians, or any questions, concerns you have about Lurie Children's. With that said, as I mentioned before, I'm joined by Julie Kalkbrenner. Our good friend Paula Nowak couldn't be here with us today, but she is with us in spirit. And you all know how, for those of you who work with Paula, you all know how to get a hold of her, and feel free to reach out to her for any questions. But today here, this portion of the program, I want to talk to you a little bit about our physician services webpage. This is created within the last year or so, and it was created for you to make to get forms and all the questions that you have for easy access for referrals and any other kind of resources that you need for Lurie Children's. So what I like to do is quickly walk you through the webpage so you can see all the great information that is there for you. And first you would do is go to, and I would encourage you to bookmark this page, is to go to luriechildrens.org/physician services. And it'll take you right to our page. And after you see the little introduction and these really wonderful people that I just showed you before, it's going to take you right to your contact resources that you all need and want and ask us about on a regular basis. So I'd like to first take you to our quick reference phone number and fax page. All you do is simply click on that page right there, and it'll pop up, and it brings you to all of our phone numbers that you need. As you see, Lurie MD there, COVID-19 call center, and then it takes you into all the specialties. And if it's anesthesia, there's a direct number there. You could see the pain management number, the chronic pain management number, and it just keeps taking you on through cardiology and through all of our many specialties there. So the wonderful thing about this is you can view it online, you can download it, as you can see right there. You can also click on the print button and you can print it on your own. So the other great tool on this is our specialist referral guide. When we were able to come into your office on a regular basis, we'd always have these nice spiral bound books for you with the information on all of our providers who would be there for you. For instance, we would take you to, let's take you to dermatology, and you'd have questions on who is on staff with dermatology, and all that information is right here for you. Again, we still have the printed books, and we are going to bring them to you, and we're going to keep bringing them in your offices, but it's also available for you here online for easy access. Additionally, our service by location grid. So many of you asked Julie, Paula, and myself, hey, do you have cardiology services at a certain location? Well, all that information is right here for you. All of our specialties, all of our locations, everything is highlighted right here for you. And again, you could download it, you could print it, or just simply view it online. It's right here for you. Then we have our satellite schedules. This is one of our most popular items that you all love having. You'll ask, what services are at Skokie, what providers are at Skokie, or what's going on at Central DuPage, Northbrook. So all you have to do is click on let's say you're looking for something at Northbrook. Here we have all our providers, what days of the week that they are there for their specialties. Now, if you keep scrolling down into the next page, one of your favorite things that you asked me about is our ancillary services and our hours for labs. So it's all right here for you. Each one of our locations, this is provided here for you. And you can, again, print, download, or view right online. And scrolling through here back to our physician services page, we have the referring a patient or consultation button. So all you do is click here, learn more about referring a patient or consultation. And you could scroll right through our online toolkit. You'll have the same things that I just showed you on the previous page, but then you'll have your patient referral forms. A lot of you ask me, the patient consultation form, can I get that? Or can I have an outpatient lab requisition? All you do is go to this page, click on outpatient requisition, and it'll open up right for you. And as you can see right from here, you're able to print or download as you need it. So we have all this available for you, every form that you need. Obviously, we're here for you to deliver them and print them as you need as well. But for quick reference, it's right here at your fingertips as you need them. So our physician services page is luriechildrens.org/physician services. And again, as I scroll through here quickly, you'll have the satellite schedules, contact resources, quick reference guides for divisions, referring a patient or consultation button. And as many of you who are online right now have attended our virtual roundtables, let's say you missed our college cardiology discussions, it's there for you. All you have to do is go right to our YouTube channel, click on that, and it'll take you right to all of our great talks that we had. 2 weeks ago, we had wonderful cardiology talks. They're all right here in a playlist for you, as well as orthopedic surgery, ENT, infectious disease, dermatology, and so on. So that kind of concludes our little physician services webpage. If you have questions regarding that, please type them in, raise your hand. Happy to answer those. And we're going to move on now to MyChart appointment scheduling. And this is more of a reminder. I know most of you are aware now that your patients can set up a Lurie Children's MyChart and go ahead and schedule their own appointment, whether it's allergy or dermatology, or if they need a gastro appointment or ortho or urology, the appointment's there for you. Now, I understand sometimes there's a long wait and no one likes the long wait to get an appointment. That's when you go ahead and if it's too long, you contact your physician liaison. We're here to help you with that. So we want to make sure everything is as smooth and easy for your patients as possible. I'd also like to remind you of the Lurie MD line. I know we've talked about this a lot, but we want to just go ahead and remind you that this is a dedicated physician-to-physician contact line. This is not for scheduling patients or for referrals. This is for a quick consult to our physician on call. So I want to thank you for joining me on this part of the presentation. I'm going to go ahead and send it over to Julie Kalkbrenner, who is going to talk to you about our coding conference.
Thank you, Chad. Good afternoon, everyone. Thank you for joining us today. I'm delighted to announce that we are having our coding program in person this year with two new speakers, Dr. Linda Parsi and Dr. Renee Slade. So Dr. Parsi has a private pediatric practice in San Antonio, and she speaks for the American Academy of Pediatrics, has really pursued coding as a requisite to run her practice profitably and in the right direction, making sure that she's getting reimbursed correctly. She's been doing this for years, and she has been, both these speakers actually were endorsed by our speakers from last year, Dr. Tuck and Danelle Holly. Renee Slade is another one of our speakers, and she's actually local. She works over at Rush. She's an employed pediatrician, and she also speaks for the American Academy of Pediatrics. Together, our presenters are going to be providing a wide variety of topics that are relevant to running a pediatric practice in today's time. So they'll be discussing coding for COVID, coding COVID consultations. They'll have a good section on telehealth, a very good section on mental health visits. Make sure you're coding those correctly and accounting for all sorts of new things that are presenting themselves for 2022. Additionally, they will be discussing the new evaluation and management codes that are set for 2022. There will be a good amount of time discussing those and the tips and tricks associated with all those new things. So this conference is set for Friday, March 11th, which is just in about 2 weeks, and it's going to be in Oak Brook. You can register by going on to lurie-children's.org/coding. And I do want to say we have about 15 to 20 spots left, so our space is going fast, and we hope that you can join us. So with that, I am going to now introduce you to Dr. Aric Shimek, who's our manager of the telehealth program at Lurie Children's, and he can talk to us about immediate care. Thank you.
Hello, good afternoon, everyone. Thank you for offering us the chance to join you today. We wanted to just reconnect with everyone and kind of go through some of the additional support tools that we have to help you and your teams through the last couple of months and years, which I know have been bumpy for all of us. So happy to be here today. Perfect. Okay. So first and foremost, I just wanted to remind everyone that we do have our two in-person immediate care centers that are available. The hours for both in Northbrook and here in the city of Chicago in Lincoln Park are 4 to 10 p.m. So helps out with the early evening and after school questions and concerns. And then over the weekend as well from noon to 6. So as mentioned in the previous slide, we do now offer the ability to self-schedule. So if you go to the website listed there at the bottom, which is lurie-children's.org/make-appointment, you'll be able to select immediate care and select either a time at Northbrook or at Lincoln Park that works for you to be seen for whatever your child may need. What we're really excited about, though, is introducing a pilot program for a new virtual immediate care offering. And again, this is meant to be in tandem to what you're already doing and in support of you and your teams and your patients, whether that's after hours or maybe other times when your office is closed. As we've seen through the last 2 years with the surge in patient demand, as well as like the surges in providers and employees being out sick, some of these technological tools have become very handy and very useful to help meet the needs of our patients, even when staffing is going up and down. So this new program, it is staffed 100% by board certified pediatricians. We are currently offering it right now in the middle of the afternoon, just to kind of test the waters and see how we do in the kind of after school period. But our goals really are very straightforward. We do want to be able to offset and offload some of the immediate treatments that are feasible over a virtual setting. But I think more importantly, and this is where my background as an ED nurse myself comes in, is it's the guidance and the education and kind of that triage process for our parents, right? Sometimes you and I both know that we can talk to someone and say, yes, this is something that we definitely want to be seen for, but it could wait till morning. That piece of information is so valuable to a parent who possibly has other kids that they're considering bundling up and getting in the car. So this kind of conversations that we can have with people about their concerns will help direct them to, go back to your PCP in the morning, or maybe this is something a little bit more serious that we'd like to see you in person for. Then lastly, like I said, just an additional resource for you and your teams as you're providing care and access to your families. So the nice thing about our Make Appointment website is that it is a one-stop shop. It's a unified pathway for both the in-person immediate care as well as the virtual. And the way that the virtual works, which I'll get into a little bit later, is we have a group of reasons for visit or chief complaints that we would consider possibly appropriate for a virtual visit. And as a family selects one of those, they're going to click through a couple of exclusion questions just to make sure that it's absolutely something that shouldn't be escalated. So the point of all of this is to say it's a resource out there for everyone to use, but it is fairly specific, right? There are many things where you would want to do some sort of testing or some sort of like special assessment. You can't necessarily look into a throat super well or swab it over, over a video conference. So we've chosen things that we think would be helpful to just kind of offload some of the patient demand and get people answers faster for you. Now, if any of your patients and families decide to use this option, it is a bundled charge process. So the telemedicine visit itself, if there's the need for an escalation to either in-person immediate care or to the Lurie Children's ED, both of those get combined into one. So I like to mention that to people just so that people understand, even if there's something else that we have to do after we see you virtually, it all kind of counts as one. So I don't want people to hesitate in using the resource because that is what we're here for. And then of course, the last bullet point there is just our e-prescription offering, making sure that parents and families can pick up prescriptions on their way home from work. And then also circling back with you and your team after the visit to make sure that you're fully aware of our follow-up plan and exactly what your child was seen for. So here on the last slide, I just wanted to show a couple of quick things. So on the left, we have again our chief complaints or reasons for visit. As you can see, they tend to be fairly basic things that we can talk or educate about over a video conference. Now, keep in mind though that not every one of these bullet points is going to be 100% correct for virtual. So that's where those extra questions come in. So vomiting, for example, if you have a patient who's vomiting, sure, it might be okay, but it might not be okay too if they can't keep fluids down. So going through those questions will help the family get directed to whatever the best resource is for what their kid needs. If it's a video visit, they get that option. And you can see on the right-hand side at the very bottom where it says, for your appointment, do you prefer in-person or virtual, right? If it's a vomiting case where the kid can't keep any fluids down, for example, and we think, we probably need to do some fluids or we probably need to put eyes on this kid in person, then they would only get the in-person option based on how they respond. So the whole decision tree process is really meant to be very intuitive and to help, again, patients find the right level of care using one website and one pathway. So that is all that I had for my piece of this. But again, if you have any questions or if you want to check it out, it's luriechildrens.org/make-appointment.
That's great. Thanks, Aric. That was a wonderful presentation on our new service here. If anybody has any questions, feel free to type them in or raise your hand and we'll be going. All right, hold on 1 second. We have a question in. And Dr. Olson writes, I am concerned about this platform taking care of business away from the medical home and potentially increasing costs as we focus on cost control in the CIN. How is this being addressed?
We are definitely also very sensitive to this topic, and we want to make sure that anything we do and anything that we offer is in support of the medical home. To date, our volumes have been very, very low. I think as people are, kind of discovering the program, but also because it is a fairly restrictive thing to get into. We're only seeing 25 reasons for visit, quote unquote, but then you also have to pass through those exclusionary questions. So at this point, we're doing a lot of the education pieces, a lot of the triage of helping mom or dad figure out, can this wait till morning? So I'm certainly sensitive to that, and I feel that we, can continue that conversation if you have ideas on ways that we can support you.
Right, and it's a good question, and we get the question a lot, and it's a really fair question, and we are this service is a supplement to your practice, is what I like to say, and it's when you're not open or there's a holiday, or we can come in and we can take care of them during those odd hours, right? And we communicate with our practices, with your patient, and we will always be in touch with you on any kind of outcome, or it's more of a, hey, here we go, this is what happened, go back to your pediatrician, and they'll help you moving forward. Does that help too sometimes, Aric, with trying to make sure everybody's on the same page, that we're not here to take anybody's patient, we're here to help you to look at your patients when you're not there?
Yeah, absolutely. I work in virtual care and have done for a couple of years, even pre-pandemic. And we've always known going into any kind of technology solution that it's never going to be perfect fit for everyone. It's never going to be such a large group of people that I think we are, endangering maybe breaking the medical home for people. So like you said, it is definitely a supportive service. We're here to just be that extra resource in those off hours, or maybe that day when your clinic is very, very busy, and somebody has a more simple chief complaint that could be handled remotely. So we're here to support you. At the end of the day, we absolutely want to make sure that that continues to be known and understood, and that this is a resource in supplement to what you're already doing.
Right. And Dr. Olson brings up another great question, or even a question we can ask is, have you called your medical home? So there is that little bit of backup, which could be something we can talk about and think about adding that. So Dr. Olson, thank you very much for these questions. So Aric, I don't see any other questions on the board right now, but can you hang on until after Dr. Suresh's presentation and see if there's anything else that pops up?
Yep, absolutely. I'll be here for any questions that you guys have.
You know what, Chad?
Oh, go ahead, Julie. Sorry.
There is another question. Will there be any walk-in labs, or are those still by appointment for the immediate care? Actually, this is probably more an immediate care question than virtual immediate care.
My understanding is the labs are by appointment only, and there is no walk-up, especially in Northbrook. But Dr. Brunner, I could follow up with you on that, because I want to make sure I give you all the correct information before I say anything out of turn. Thank you, Julie. So with that said, we're going to go ahead and move on to the next portion of our program. And we are excited to bring in Dr. Robert Greenberg, who is here to talk about our complex care program. And Dr. Greenberg, are you here with us?
I am. Can you hear me okay?
We hear you and see you well. Everybody, I'm going to go ahead and turn it over to Dr. Greenberg. Have a great presentation.
Thanks, Chad. And you can go to the next slide. I'm excited to join you all today to talk to you about our complex care program pilot. Just launched a few months ago, and I have a few slides here to share. Our mission as a team is to work with primary medical homes in providing care for children with medical complexity in a variety of different settings. And the way we are organized is as a consultative and co-management service. So what that means is that we have care coordinators in our program that enroll patients and meet with them regularly by phone. And we also have twice yearly visits with physicians in our program to really talk with families about their child. When patients are admitted to Lurie Children's, we are available as consultants to the primary medical teams to work with them and establish some continuity. And really, we hope that this bridges the inpatient, outpatient, and other ways in which patients seek care in the healthcare system. You can go to the next slide. A little background about complex care programs. So they've been shown to really improve outcomes in a variety of domains. They can increase family satisfaction with healthcare as a system. They can sometimes help reduce patients' unmet healthcare needs, and that is especially the case in the outpatient side in the subspecialty areas. And some programs have been successful in reducing emergency department visits and hospitalizations, or in some cases reducing length of stay, which increases days at home. Again, our model is a co-management model with primary care. And so our multidisciplinary team, which I'll introduce to you all in a second, is doctors and nurse care coordinators and social work care coordinators and our program coordinator, again, trying to establish increased continuity across inpatient, outpatient, and school settings. I want to mention here a few things that we won't provide as part of this co-management program, and that is well childcare, vaccines, preventive healthcare screenings, labs, or at this point, any general acute care visits for any short-term issues. This is really meant to be a longitudinal program to work in collaboration with the primary care medical home. So I want to talk about just patients that we're including in this pilot phase. And so I have inclusion criteria. On the next slide, we have some exclusion criteria. So patients who are 17 years of age or younger have a complex chronic medical condition. And this really means a patient that is followed by 3 or more medical or surgical subspecialists. Patients that have medical technology usage, so a feeding tube, for example, like G-tube, a tracheostomy, and really patients that have high chronic medical utilization evidenced by frequent emergency department visits, procedures, inpatient hospitalizations, or prolonged inpatient stays. Additionally, we're trying to address patients that have unmet care coordination needs as well. So there are some patients that have a pre-existing medical home in a subspecialty area due to a complex chronic condition, for example, oncology. And so these patients have the wraparound services that include care coordination and partnership with the medical home. And so we're really not focusing on this group at this point. There are some patients that have some complex social situations, but may not have complex chronic medical conditions. And so this is another group that we're not specifically targeting at this point. And then there are patients that need care coordination, but perhaps not the physician piece of our program. We're happy to direct these patients towards our care coordination programs, but at this point, those patients are folks that we are not enrolling. So how do you refer folks to us? There's a couple ways. You can go to the next slide. So we have a request for service order that can be entered through Epicare Link or Epicare Community Connect if you have access to these. This is a short a form to fill out, sort of confirming that the patients in general meet the criteria for inclusion, and you're encouraged to put a brief one-liner in here as well. And we review these referrals on a weekly basis as a team. In addition, for patients while they're hospitalized at Lurie Children's, we have a complex care consult order. And so any primary care team in the hospital, whether it be subspecialty or general pediatric care, can consult our program for patients that are candidates for enrollment or who are already enrolled in the program. And we will follow these patients during their inpatient stay and try to support that communication among subspecialists and with their medical home. For those folks that do not have access to Epic Community Connect or Epicare Link, you're welcome to reach out to our office, to fax our office, or to email our program at complexcare@luriechildrens.org. And Bree would be more than happy to share with you our fax form to complete a referral as well. And so this can be obtained this way, and we can send it to you via email or via fax for any patients that you'd like to refer using this method. So I'll close with just introducing you to the team. I couldn't be joined today by my co-medical director, Carolyn Foster, from the Division of Advanced General Pediatrics. We also have a program coordinator, Bree Brady, 5 pediatrician clinicians that are from the divisions of hospital-based medicine and advanced general pediatrics that you can see there, and 4 care coordinators with nursing or social work background to support families and patients and caregivers. So I'm happy to answer any questions, but we're very excited to launch this program and really looking forward to working with you. Thanks.
Thank you, Dr. Greenberg. That was a great presentation. I hope some of you will be able to incorporate this complex care program into your practice for the best care for these patients with complex medical needs. Can you talk to us a little bit about, since we were talking about telemedicine before, if you use telemedicine with these visits or these patients?
Telemedicine is a prime way in which we'll interact with patients for their twice yearly visits. We want to be as convenient as possible for patients and families and caregivers, and so telemedicine is absolutely an option for many of our visits.
Great, okay. And you're typically following patients who are seen by specialists within Lurie, right? So it could be a component of 3 or more specialists that are seen at Lurie, correct? Just to clarify.
So I think we're going to confer the greatest benefit to patients who may be hospitalized at Lurie Children's, because I think it's really being available on a longitudinal basis for outpatient support, but as well being available during a time of hospitalization. It's not necessary that patients are exclusively followed at Lurie for this program at all, but we do think we're going to provide the greatest benefit to patients who, in the event of a hospitalization, would be able to be followed by us on the inpatient side.
Excellent. Okay, if there are any other questions by our attendees, please feel free to type them in the question box on your screens. And thank you, Dr. Greenberg, for that information. I now would like to introduce you to Dr. Suresh, who's we have a new position at Lurie, our Chief of Provider Integration, and he is here for all of the referring pediatricians and everybody out in the community. So Dr. Suresh, I will let you take it up from here. Thank you.
Thank you. Thank you very much, Julie. And first thing, very good afternoon to all of you. And thank you for giving me the opportunity to connect with you. I heard Jim Olson was on the line. So, Jim and I have had many conversations regarding my role. So I am a pediatrician like all of you who went on to then do anesthesia. Then I did pediatric anesthesia and pain medicine. And I served as the chair of the anesthesia department for the last 9.5 years. So early last year, Tom Shanley gave me an opportunity to take on a new role as a senior vice president and chief of provider integration. The title seems big, but essentially it is, I'm your window to Lurie Children's. So consider me as the point person that you can reach out for anything. My whole goal here is to ensure that anything that you need, whether it may be help with finding the right specialists or help with anything in your practices. My area of expertise is in pain medicine. One of the main charges that I've taken on now is to reduce this whole issue of the opioid crisis, both nationally as well as locally. So any information that I can provide you for your practices or connect with your practices, I've been very fortunate to have Julie and Chad and Paula help me actually visit some of your practices, and I'm happy to come and visit your practices if your time permits. My role here, as I said to you, is to be your liaison between Lurie Children's and your individual practices. So I'm Chelsea Ann, who will serve as my administrative support. So feel free. Her email as well as my email is listed, as well as telephone numbers. No question is silly. No question is not necessary to be answered. So feel free to reach out to me with any questions whatsoever, or any help that I can provide, because as I said, I have been given this opportunity to serve all of you. So feel free to reach out to me. I'm happy to take any questions. Chad?
I am looking for some questions right now for you, and right now nothing's popping up. But I'd love that you offered to come along with us to visit some of the practices. So is there certain days of the week, or are we flexible to, a lot of times they're busy, and certain pediatricians are busy at certain times of day or certain times of the week. So like maybe we can come on Tuesday or through Friday, some of those days. Anything that works specific for you, or are you pretty open?
Yeah. So for me, my busy meeting day is almost always Wednesdays. I have a lot of meetings here at the hospital on Wednesdays. But other than that, again, if you work with Chelsea Ann, she should be able to find a window for us to get to any of the practices. And I can come and help with some of the education you need in the event. One of my areas of interest that I have a fair amount of NIH funding and work that I've done is also anesthesia exposure in children. There's issues with neurocognitive changes, etc. And I'm happy to come and talk to your practices to allay fears that parents may have, or talk to them about pain medicine. Any topic of interest to you. As I said, I've been around the block here. This is my 31st year that I've been at Lurie Children's, which used to be Children's Memorial. So I think most of you who have passed through the Lurie system or Children's Memorial, you probably would know me if you see me, or we've at some point touched base with each other.
You're going to be a great conduit to all resources at Lurie Children's, and we're excited for that. And I'm sure people are going to have questions along the line for you, Dr. Suresh. And we're excited. We're excited to have you with us. So I'm seeing if we have any questions for you. Oh, go ahead. Please.
I also want to point out to all of you that this group has been amazing. My interaction with the outreach group with Paula Novak, Chad, and Julie, and Jill Keats. I mean, they get the work done. And again, I know most of you are familiar with them, but they connect right away with me if there's any questions. So feel free, if you're not able to get a hold of me, which I generally will answer my email wherever I am. But you can also farm any questions through them, and they will reach out to me right away.
Excellent. Well, thank you for that, Dr. Suresh. So we're going to go to the forum portion of our program. And Julie, we're going to go through some of the questions that we have online here. And one of them, Dr. Suresh, thank you for joining us. And just stay with us just in case something pops up, okay? We'll be, I'll let you know. But Julie, looks like we have a question in for Dr. Greenberg. Dr. Greenberg, Aaron Tabak asked, is your program different from the care coordination program that they already use? Would you like to comment on that, or would you like us to go ahead? And
I'm happy to comment. Thanks for the question. Right. I would look at it as a supplement to it. So we have existing care coordination resources and programs at Lurie, and this adds an additional layer of a program coordinator in BRIE, as well as physician input as well in a co-management model. And so patients that receive care coordination have great care coordinators at Lurie Children's, and we add to that an element of following patients when they're hospitalized, and times for checking in with the program in general, either through telemedicine or in-person appointments a couple times a year. And so they are different, but complementary.
Oh, Dr. Greenberg, I have another question for you. So if these patients are enrolled in your program, how are you working with the pediatricians that are possibly referring them into your program? Is there some sort of communication that's shared between the two physicians?
There is. So when a patient is referred to our program, we review their chart and get back to the referring providers on whether they would be enrolled. We Also reach out to the families and caregivers to start a health risk assessment and to enroll them into the program. After we meet with patients, families, and caregivers, we do write a note and make sure that we send that to the primary care medical home. And we will also be reaching out by phone or in other ways to reach out to the medical home to figure out ways in which we can collaborate further. And so that's our plan.
Excellent. Okay. I didn't see any other questions for the complex care program.
I do not either. Looks like we do have a question in on, can our patients make appointments online for radiology or the outpatient lab online as well? I don't believe you can make an appointment online for the outpatient lab. However, I believe radiology services are available. Julie or Aric, would you be able to confirm that for me?
I apologize. I do not know off the top of my head, but happy to find an answer and get it out to you.
Great. We can do that as well, but appreciate you jumping in real quick here, Aric. So, all right. Aaron Tabak, I will get back to you on the radiology question. I believe that it's yes, you can, but yeah, definitely on the outpatient lab, you cannot. So, but we'll get back to you on that one. So, for my friend Julie, who is frozen in time right there, as you can see, I just want to go ahead and on behalf of Dr. Suresh, Dr. Greenberg, and Aric Tabak, as well as our friend Paula Nowak, we'd just like to thank you for joining us this afternoon. This session is recorded and we'll be sending it to you later on this afternoon. I encourage you to share this with your colleagues in your office so they can see the presentations, as well as get to know the physician services webpage a little bit better, so you can easily access all of our information. But lastly, if you are ready for us to come into your office, and I could bring Dr. Suresh or another one of our great specialists here at Lurie Children's, please reach out to me, Julie, or Paula. We could schedule that appointment. But until next time, I'd like to thank you for being such a great partner to Lurie Children's, and we love having you as one of our pediatric healthcare providers. Have a wonderful day. Thank you.
Thank you very much.